Good afternoon, friends. We have the Associate Dean of Indian International Institute of Health Management Research, which is located at Dwarka, Divya Agarwal ji. So she'll talk about the admissions and their academic excellence.
Thank you. Basically, at IIHMR Delhi, we offer 3 academic programs. The first program is 2-year full-time postgraduate program in hospital and health management, and we have specialization into the area of hospital management, and health information technology. The second program that we offer is for the working professionals. So as we receive the demand and request from the health professionals when they are crippling with the management issues, so we designed the program looking into their problem areas, and we offer this program into the weekend mode, right? And the mode of the study is online mode because they are working in their respective hospitals. Then the third program, now we realize that the people who are already into the healthcare profession and they are already postgraduate, but they want to hone up their research skills, right? So that they can contribute in the research or the evidence generation. So we launched last year 3-year full-time fellowship program in management, which is duly approved by AICTE. Now this FPM program generally focuses upon the 3 areas of hospital management, and health information technology. So those who want to explore or hone up their research skills, so they can enroll for this particular program of fellowship program. Then when I spoke about the PGDM program, which is a 2-year full-time program, this is NBA accredited, AIU approved. AIU means it has got the equivalence of it has got the equivalence of master's degree. So PGDM is equivalent to MBA program, and many of our alumni, right, they are doing their PhD courses in different international universities as well after doing this course. As far as the placements are concerned of IIHMR Delhi, since inception, since 2008, we have got 100% placement record of all the students who graduate from IIHMR Delhi. Now, when we talk about international institute, so we try to bring or give that exposure to our students into the international domain by tying up or collaborating with different international universities. Like we have done a collaboration with Imperial College London, where the faculty of both the institutions, they collaboratively work on the research projects related to public health importance. Plus, we have collaborated with Mahidol University, which is a Thailand-based university, for the faculty exchange and student exchange program so that the cross-learning can take place. Now, to give an exposure to the students into the international hospital sector, so we have done a partnership with RAG Hospital and Emirates Hospital, which are UAE-based hospitals, and students, they get exposure in these particular hospitals.
One thing, ma'am, just occurred to me, when you're talking about international, so are we also getting international students from, foreign countries?
Okay. So for that, for students, we have not been given that kind of grant from AICTE, because for that certain regulations have to be adopted. But we get the health professionals from not only from India, but from the health professionals from Asia Pacific region, including Sri Lanka, Maldives, Bhutan, Bangladesh, Myanmar, and Sri Lanka. So they come regularly. They have been nominated by their respective Ministry of Health to get capacitated into the areas of hospital management, NGO management, and leadership skills.
So we don't have any, it's not a reservation, but they are coming.
They are coming regularly. Last year, because of the restriction, right, we received a batch from NHM Odisha, which specifically requested us to conduct an international tour to a different country to give them an exposure of public health system, right? So we have postponed it for this year. We will carry out that particular international assignment this year only.
Normally, programs, academic programs, they are for what duration? Is it a 1 year, 12 months, or is
Which one?
Any major programs?
See, when we are talking about when we are getting the delegates, yes, right? So these programs are specifically 3 days or 5 days or 2 weeks program, short-term duration programs.
They're advanced level, for seniors.
The system.
Yes.
Right.
And the last thing, just before we end up,
you want to know the placements where the student get placed?
that would be nice, ma'am.
Okay. When I divided sector-wise, so in health management, the students get placed in organizations like UNICEF, EY, PwC, right? NHMs of different state. Right. Then WHO has also picked up our students when the students have directly applied to them. Right. So we send the recommendation letter to them, and they get automatically being enrolled into their different programs. Right. Then Piramal Swasthya, right? So various public health organizations.
Stars like of the.
Yeah,
of
so
the
they
Indian
go
medical
into
scene.
these organization, then hospital. In hospital, our students, you name any hospitals, our presence is there. Like Max, Fortis, Medanta, Rockland, then AIMS, then Rajiv Gandhi Cancer Hospital, Sitaram Bharti Hospital, Narayana Hospital. Everywhere you will get the presence of IHMR Delhi students.
Yes, perfect, ma'am. And just last question was, since telemedicine, due to the corona, has taken, it's come in the forefront. So, do you have something inculcated in your program?
Yes, we have a specific specialization which was first launched by IIHMR Delhi, and it is into health information technology. So this,
I wanted to
yes,
ask.
so the in health information technology, these students they generally act as an interface between a doctor and a software programmer, right? They understand both the languages. Now, whenever the facility or healthcare facility is facing any kind of crisis or problems, they specifically give that requisition to the health IT managers. Now they convey the same to the software programmers. They develop the solution together, and then they implement the entire system into the hospital vertical or in the public health scenario. They are working on data analytics. When they have the huge data with respect to the COVID or the COVID data related data, so they have done a lot of analysis of all these data. Plus, a student, if I must quote that many of our students are contributing towards the Ayushman Bharat initiative of Government of India. They have closely worked with Dr. Indu Bhushan, Dr. Vinod Paul, right? And they are also contributing a lot of the alumni of IHMR Delhi. They are working into the ABDM project, that is Ayushman Bharat Digital Mission Project, and they are going to make a huge contribution when the digitization of the entire country will take place.
So then I think that in the future, like the startup, ecosystem will also benefit. There will be people who are going to the health management systems.
See, because IHMR has got a legacy of 37 years, right? So our alumni has reached up to a level of the directors. They have started their own organization. They are going into the entrepreneurial mode. They have those leadership skills, which is well acclaimed. And it's not only that we need to approach the recruiters. The alumni itself, they become the recruiters of our current batch students as well.
Ma'am, if you allow me, since when we talk about, so I wanted to know your background, your career background.
Okay, right. Basically, I have done my graduation in instrumentation from Delhi University. After that, I did my MBA, and I was specialized in human resource vertical as well as organizational behavior. Then I was being recruited by Maruti Udyog, where I worked for 6 years in the capacity of the senior manager HR. I was looking into the various grievance issues as well as the labor disputes. Right after that, I realized it's better to make a contribution where the young crowd could be nurtured or enriched with the HR related aspects. So I worked into the academic domain for the last 16 years. Right, and for the IHMR, I am working since last 7 years. So I'm capacitating the health managers into the HR vertical of the health system, which is which is the need of the hour.
True.
Currently.
Because actually, when the students or anybody who's going to watch this interview, so we want they'll have a question in their mind कि किसका इंटरव्यू चल रहा है, उनका जानना चाहेंगे, वो सर्च करेंगे गूगल पे दिव्या अग्रवाल विकीपीडिया or something like that. So मैंने कहा it's better to tell them on this camera. Yeah. So thank you, ma'am. I'm Sanjay Agarwal, and it's a pleasure meeting you, ma'am. Thank you, sir. Stop कर दीजिएगा.